we officially kick off the webinar so that others can join us. So good afternoon, and thank you for joining us today for this session on MyARTA. We are excited to tour you through this fantastic new online platform that provides real-time self-service options for your retiree benefits plan. My name is Amanda Shaw, and I'm the Chief Marketing Officer for ARTA. I'm joined today by Gary Sawatsky, who is our Chief Operating Officer, as well as by Suzanne Mafosa, our Member Services Team Lead, Jennifer Hope, our Affiliate Marketing Advisor, and Christine Janikas, our Senior Executive Assistant on Tech Support. We've pulled some of our best and brightest together to be able to answer any questions that you might have throughout the webinar today. As you may have realized, we have disabled attendee video and audio capability. This will help us ensure a quality experience for all of our participants today by limiting web streaming. It also allows us to record this webinar for future use and to make it available for you to access after the webinar today without breaching your privacy. With your audio muted, we encourage you to use the Q&A feature found at the bottom of your screen to submit questions. You can see it says Q&A with two little speech bubbles. You can just pop that open and type your questions in. You can submit questions publicly so that all attendees can see them, or you could submit them privately so that only our ARTA staff can see them. This is our fourth webinar, and we've had people submit personal questions publicly. So if you are including personal information, we would encourage you to use the private question submission feature just to protect your security a little bit. Our team will respond to questions throughout the webinar. We'll also stop midway through to really answer some questions live that might apply to everybody. We have also created two polls with questions that you can answer. Participation is optional and anonymous and simply provides us with some information that we can use as we continue to develop the ARTA Retiree Benefits Plan and the tools we use to support it. We're going to open the first poll now. And with those housekeeping matters completed, I'm excited to welcome Gary to open our webinar with an introduction.
Good afternoon, everyone. Thank you so much for joining us today. We have some great new tools to share with you. We're really excited about them. We have a lot of changes going on at ARTA right now. We are updating our member portal site, which you'll see more of today. We are moving to self-administration, which is a huge step forward for us. And we have a new claims adjudicator. As I'm sure you can appreciate, there's a lot of rough parts we need to iron out. So we thank you very much for your patience. We have had a lot of phone calls from our members. As we expected, any change like this is going to result in a lot of phone calls. They are being a little bit overwhelmed right now. So I always thank you for your patience. It is, we just rest assured, we will get to your message. If you are calling, we will answer that call eventually. We expect the calls will continue to be busy for the next couple of weeks, but we do expect them to subside. In the meantime, we also have a lot of great self-service options for you, and we're going to show you one of those today. So with that, I'll turn it back over to Amanda.
Great, thank you. So yes, there is a lot to discover on MyARTA, and so we're going to jump right in. Thank you for completing the poll. I do see that many of you have successfully registered for MyARTA, which is great. For those that are maybe still experiencing some difficulties, we're going to walk through the process quickly here together. The wonderful thing about serving retired teachers and like-minded professionals is that you're fantastic at providing feedback, and that has allowed us to make our tools even better and a little more clear. So if you visited MyARTA earlier in the year, the text was slightly different. We've already updated it so that if this is your first time logging in, it's very clear that if this is your first time logging on to the new MyARTA website, please click here to verify your account. So while your account has been created and your retiree benefits plan is active, we do need you to create a new account for MyARTA separate than your ASVP MyARTA healthcare account. That does seem to be a common recurring problem. So we're going to do a test scenario here together. And when we create our test scenario, I'm deliberately going to put in some wrong information so that you can see the types of error messages that may come up. So let's just pretend this is our email address for our friend Frank. And we're going to make Frank a password. And we're going to click sign up. So for you, you're going to want to use the email address that ARTA has on record. So if you've changed your email address, but haven't updated it with ARTA, we're going to need you to start by verifying it with the ARTA email address that you have on file. You will be able to update it later in the process, but for now you need to use the email that we have on file. If you're not sure what that is, again, just send an email to info@arta.net. Jennifer and I, as well as the member services team, have been working through these emails to make sure that you can verify your information and log on to MyARTA. So we click sign up, and then this is when it's going to ask you to verify your ARTA membership information. So you need your 5-digit member ID number that can be found on your new ID card that you would have been mailed in December, your date of birth. So for Frank, I'm just going to put his in here. And then your postal code. So when you're entering your postal code, it doesn't matter if you have this space in between the first 3 digits and the next 3. It will accept it no matter what, but you do need the correct postal code that ARTA has on your system. And then you click verify account. Now, we're unable to create verification because we've already created an account with this ARTA member ID. But as you can see, it does tell you what information looks good and what information was incorrect. So in this case, we would have needed to use a different ARTA member ID in order to create our account. When you put in your information, it will successfully verify your account and you'll be able to sign into MyARTA. So let's log in together. Oh, I guess I'm going to have to sign out of our, there we go. I apologize, I'm in a different room than I've done most of these webinars because my five-year-old's e-learning kicked me out of my office. So hopefully the retired teachers can understand how fun that's been. So let's just log on here. Okay, and so now we've successfully logged in. So once we're in, there are some key sections here for you to know. This homepage has all of the announcements specific to your retiree benefits plan. You can click on any on continue reading to read more. There's also a custom sidebar on each homepage that has specific help information for that page. So for example, if we look at the benefits and claims forms, you can see that the sidebar information is different so that it provides specific help to the page that you're on at that time. We will come back to this tab, but the first tab we're going to look at is the Update My Information tab. Located in the purple box near the top of the page, this section allows you to update your personal information, such as your mailing address, your phone number, and your email address. So here's the place where if you have updated your email address or your contact information, you can update it yourself on the website, and then that will update in all of the ARTA systems. You can also change your password from this area and manage your communications with ARTA. So our magazine that we send out by print mail, as well as our e-newsletter that we send out. Next, we can look at our help section. So the help section is found up at the top as well. The help section includes a link to all of the tutorial videos that we've posted on YouTube. So the topics you can see are here. There's a variety of topics, including how to submit different types of claims, to check your coverage, how to use the drug lookup tool, all of which we'll try and cover in this session today. There's also an information piece here that lets you know which forms need to be submitted to which address. There are 2 addresses that you submit forms to. Both addresses will be on their appropriate forms, but we also just provide this list here. It just reminds you that if you're submitting hard copy claims, you do it directly to our claims adjudicator, Greenfield Canada. Almost all other forms will come direct to our office. Now, this blue MyARTA claims bar is where you'll find several important areas of information, which we will come back to this session as well. And while we strongly encourage all of our members to now submit their claims through this ARTA claims portal, we do understand that there's a need to submit some claims by mail, and these mail-in documents can be found back under this benefits and claims form section. Benefits and claims form sections also allow you to access other forms you may need while managing your retiree benefits plan, such as forms that you might need under benefits forms to change your coverage, terminate your coverage, or manage your dependents. There are forms related to travel. So if you need to make an emergency travel claim, all of that information is here. Our travel provider Allianz also allows for online claim submissions now. And so there's a link to their online claim submission as well. My Documents is going to be a very useful section. This is your personal repository of all of your ARTA membership documents. Right now, you can come to this page to download and print copies of your member ID card by simply clicking the Download My ARTA Benefits ID card button. If you have a spouse or dependents covered by your plan, you can download and email them this same card, and they can use it by printing a copy or by saving it on their phone and showing it to providers. In February, this section will expand to include your annual premiums and claim statements for tax purposes. And in September, you'll also be able to find your annual renewal statement here. When we upload those documents, you will receive notification that they have been posted here, but this is the section where you'll find them. The next section is Contact Us. So this Contact Us session allows you to contact our member services team directly. I know many of you have found it because we have received many submissions through it already. You can choose a topic from the drop-down list. So there's a variety of topics you can select, and then you can choose your primary method of contact. So you can come and use this phone and say you'd like a phone call and then provide a message, and our member services team is working to answer all of these and to provide the assistance that you need. This is a great tool to give us the information that we need so that when we respond to you, we can provide you with all of the information you need right away. So simply by submitting this, it alerts our member services team and they're responding to them in the order that they are received. I'm just going to take a minute and we can answer any of the questions that have been found. So I see that someone has messaged that their email address is being found as not found. That likely means that the email address that you are using does not match what is in the ARTA system. So if that's the case, I encourage you to send an email to either info@arta.net or marketing@arta.net, and our team will be happy to verify what email address we have on file for you and make sure that we get you logged into MyARTA. So that has been Jen's and my priority lately, and so we're excited to get as many of you onto MyARTA as we can. If there are any other questions, we'd be excited to look at them now. Otherwise, we're going to log on to the MyARTA claims portal. Yes, the premiums and claims statement that you receive in 2020 will look the same as the previous ones that you've received from ASEDP. We are promising them by February 28th. I see that it says will it be February 1st or end of February. So February 28th will be the latest you get them, but we do hope to have them available before that as well. There is a question about submitting receipts. And so we can look at that one a little bit once we get into the MyARTA claims portal. Okay. There are some other questions, but they're pretty specific, so I'm going to leave them for Jen. If you can just type responses to those individuals. Let's log on to MyARTA claims. So MyARTA claims is where you can submit claims, track your eligible coverage, and so much more. When we clicked on MyARTA claims and then the blue Access ARTA claims portal button, it redirects us to the MyARTA claims session. There are some really handy features in here. On your personalized dashboard, there's quick links to several of them, as well as a summary of your recent claims. We're going to start by looking at Find a Health Provider. So Find a Health Provider is a tool that would be extremely useful if you're traveling within Canada and need an emergency service provider, or if you're looking for a new service provider that lives or works close to where you live. You can bring it up and enter your location that you're searching for, and then select a provider type. And it will pull up a list of service providers that match your criteria. You can also search for those that direct bill to make it even easier for you, or you can filter on recently visited. So We think this tool will be really handy if you happen to be traveling within Canada and say you crack a tooth or chip a tooth, you could find a dental provider that is recognized by the ARTA system and be able to go in and see them for your needs. To look at submitting a claim, again, you can either go to the quick access, submit a claim. You can also go My Claims, submit a claim. We don't cover how to submit a claim in this webinar. There is a separate webinar specifically on how to do so, and we encourage you to register for one of those sessions or view the video tutorials on YouTube if you'd like some extra guidance on this. The last MyARTA tour session we did have some extra time at the end, and if that is the same here, we can come back and do a claim together today. This section under My Claims also has personalized claims forms. This would be helpful. You can either download a general claim form or a dental form. You can select your participant and then view the form. It will pre-populate your personal information, so your name and your benefits ID number, and then you can print that form and take it with you to a service provider to have them complete that form with you. So if they don't offer direct billing, this is a way you can take the form to them and have them do that in advance without you having to fill out your personalized information. Also under My Claims is My Claim Statements. So this is an archive of all of the claims you've submitted using this online system. So any claims that you've previously submitted to ASCBP, you will not be able to access through this, but any claims that you submit through this system, you'll be able to find on here. If you have claims from 2020 that you have yet to submit, you can submit them through this system, and then they will appear as claim statements on the system. You can also search your claims history, which allows you to search by your plan member or dependents, as well as the type of benefit, as well as either by date range or by year. And that will pull up a list of those claims for you. So in this case, we could search for our plan member, Jane. We could say we're looking for any of her extended health services, and we're looking for claims submitted in 2021, or I guess we can do 2020, and then we can display the claims information, and that will pull up any claims that do match. Now, obviously, we did not submit any claims in 2020, so it is showing that no claims were found for that selection criteria. The last item under this dropdown is My Web Uploads. Now, My Web Uploads provides you with status updates for claims that require manual adjudication by our adjudication provider. So this allows you to see the status of a claim that you've submitted. It will show you whether that claim has just been received or if adjudication is in progress. So this will be especially true for drug claims. All drug claims are manually adjudicated, so they'll appear in this list, and they'll show whether the claim has been received or if a claim is in progress of being adjudicated. Once the claim has successfully been adjudicated, they'll be processed and they will no longer appear on My Web Uploads. You'll then be able to find them in your claims history, or again on MyARTA Claims Home under your recent claims section. The Plan Member Summary tab is a high-level summary of your retiree benefits plan information. You can come here to review your coverage that you have. This is where it will be listed at a high level. Support Center is a page, help section specific to the MyARTA claims page, and it is loaded with answers to frequently asked questions to help you make the most of your experience. So this is a great area. It again links to the tutorial videos that we have on MyARTA. It also answers questions including how do I submit a claim? There are travel and COVID-19 related frequently asked questions, as well as a full list of frequently asked questions. There's 67, so you can also search and narrow your results down that way. I'm going to go back to the MyARTA Claims home and just show those two key areas on the main homepage. So there's check coverage and there's submit a claim. Check coverage allows you to check your eligible coverage before you receive a service or treatment. Quick access allows you to, or the submitting a claims allows you to submit your claim once you've already received the service. So in this case, we could check our coverage, and let's check our coverage for massage. So we click the button, and then we have to select our plan participant. So we can we'll select Jane. We'll say that she is looking to get a 1-hour massage, and she's looking to get that massage today, and that massage is going to cost her $90. We'll say that she's going to receive that treatment in Alberta, and then we submit. As you can see, it does say this is an eligibility check. So it does tell you that, okay, these are the submission results for the information you input. It does show that we've already used $383 to date. And it's asking us, it's actually not showing the results because I had already run this earlier today. So I'll go back again and do it with a different feature so that we can get some different results. So let's say we're going for a physio treatment instead. So we're sending Jane for physio. We'll send her today. Again, we'll say it was a $75 physio treatment and that she was getting it in Alberta. And then we submit. And so here we can see that of the $75, the ARTA Retiree Benefits Plan will pay $60 and that Jane will be responsible to pay $15. It does show your plan limitations. So it does show that Jane has used $383 so far this year. And it does let you know that for paramedical services, there is the copay of 20%. So this just allows you to check what your coverage level is and how much you've spent to date. Similarly, you can also do a search for drugs. So with the drugs, it doesn't show you how much you have remaining on your plan just because there's coordination of benefits with the government drug plans, as well as different plan maximums under our ARTA plans. But you can search by a drug. Gary, I'm going to need you to remind me what drug you like to search for again.
Atorvastatin, ATORV.
Perfect. So we're going to search. We don't need to spell the whole word because Gary likes complicated drug names. So I'm going to just search for Atorv. You can also search by drug identification number. So earlier today, a member and I walked through a type of medication she was looking for related to cancer treatments. She knew the DIN number, so we were able to search that together and find her results. So again, we just select the participant that we're running the search for, and we click search. Okay, so now it's going to ask us to confirm our drug. If you had selected a drug or used the drug identification number, it would skip this step. But for us, we have 4 different options for atorvastatin. And so let's choose that we want the 20 milligram tablet. And again, you can hit confirm. And this will provide you with a summary of what is available. So here you can see that this drug is covered by the ARTA Retiree Benefits Plan. It is subject to a 20% copay and is also subject to the maximums on our plans. So this way, it also provides us the drug identification number. So this way, you know, heading into your pharmacist that your prescription should be covered to this amount, and you can let them know accordingly. So I will take a minute here to just check to see if there are questions. And if we go through questions, then we can proceed with submitting a claim as well. So there is a question in regards to chiropractic claims from both December 2020 and January 2021, and can I submit them both on the same claim form? Yes, you can, provided that it was the same chiropractor. So we can walk through an example together. As long as the service provider is the same, you can submit up to 5 treatments on one claim form. Doesn't look like we have any other questions. We certainly encourage all questions, but in the meantime, we can do a claim together. So we'll go My Claims, Submit a Claim. And so from here, you can choose from a wide variety of different options. So in this case, we can do a professional services, and let's stick with physiotherapy since it's treating us well this afternoon. So if you have used this claim system to submit a claim before, it will remember your previous providers and it will provide them at the top so that you can quickly just click on their name and keep going. We can do another example later that shows what that looks like. But if it is your first time or if you have used a new provider, you do need to search for a provider. You can search by either phone number or by last name. Phone number will provide much more specific results. You can see when we do by last name, I always use Smith because I always get results. And so we'll search and you can see that there are a variety of physiotherapists with that name in the system. So again, if you have the phone number, it will provide more specific results, but this works as well. And so we'll say we're visiting a physiotherapist in Fort McMurray. And so you can see that it pre-populates that information for you on the claims form. So then you do need to indicate who the claim is for, whether it's yourself or one of your dependents. And it does ask if there's coverage under another benefits plan. Now, this is another private benefits plan. So this does not include government coverage. This is specific to if you had another private benefits plan through a spouse, like a Sun Life or a Manulife. For the majority of our ARTA members, they do not have coverage under another private benefits plan. You can then say if treatment is required due to a motor vehicle accident or a work-related injury. And then if you have a medical prescription to submit with this claim. If you do have a medical prescription to submit with your claim, you select yes. And then you need to put the date of that prescription as well as the type of medical professional who prescribed this treatment for you. You can then select your type of treatment and the date of treatment. And then the total amount of your visit. And then at the bottom here, you submit your claim. Now, as you can see, it did not ask us for a receipt. For many claims, you will not need to provide a receipt. We ask that you hang on to all of those receipts, file them for 13 months, just in case you are randomly selected for audit. If you are selected for an audit, it usually happens quite soon after submitting your claim. And then that is when you'll receive an email with instructions on how to submit receipts. But for most of our claims, you will not need to submit a receipt. The screen asks you to confirm your details, so it gives you a chance to review them again before you hit submit. So once you've submitted, you will get a claim submission page. There is the option to print in the top right-hand corner here if you'd like to print a copy for your records. Again, they'll also be in your claims history on the portal, but if you would prefer a hard copy, that is an option as well. It does show here that we claimed $100, that Jane is responsible for paying $20, and that the ARTA Retiree Benefits Plan will pay the remaining $80. And as you can see, it says awaiting payment. So our claim's been approved and is just awaiting payment. Payments for claims with the status of awaiting payment will be processed on the next business day. So you will receive your payment the next business day. And again, now it's just showing that poor Jane, she's almost used up all of her maximum and we're only on January 8th. It's been a rough week for her. So it does let you know your plan limitations and how much you've claimed against your plan. So again, now this claim that we've submitted, you will be able to find it on MyARTA Claims Home under our recent claims. We have it right here, our physiotherapy submission, and that it's awaiting payment. So this is a great little dashboard to see if your claims are awaiting payment, or if they've been denied, or if it's a drug claim, if they're received or in progress. So all of that information is here. You can also see that once a claim has been paid and listed as paid, you can also view your claim statement directly from here by just clicking on view. And so this is a copy of the statement that shows that Jane was paid for this claim. There are some questions coming in, which is great. It asks, where does it tell you if a prescription is required for a service? Gary, I don't think the system tells us that.
The system would just tell us that. Suzanne, you know the details better than I do, but I don't believe you require a prescription for those types of paramedical practitioners.
No, I was just responding. A prescription is not required for paramedical services, physio, chiro, massage, acupuncture. We just need, you just need to make sure your provider of services is registered and in good standing with the association. So if you need more information, you can always look at the contract, the plan text document. It is available on the website.
So while you don't need a prescription, I know sometimes people are given prescriptions for those treatments, and so it's just giving you an option to indicate that it was because of a prescription, but you do not need one. There's a question about direct billing. Yes, any providers that have been able to direct bill in the past will still be able to direct bill. So submitting online claims is only necessary if your provider does not have the capabilities for direct billing. We know that's especially true in some of our rural communities. But if your provider is direct billed, they will absolutely still be able to continue to direct bill your claims. They'll still be able to direct bill to the provincial drug plans. So I know if you go to a pharmacy and your pharmacist bills the Alberta Senior Drug Plan, they'll still be able to do so, and then they'll still be able to direct bill the ARTA plan as well. So that will still happen. There is a question right now regarding massage. Yes, so right now in Alberta, you do require a massage. You need a prescription for a massage due to COVID. That's unrelated to your benefits plan. So our benefits plan will cover massages that are covered with no prescription. The prescription is required for massages for, because that is the guidelines put in place by AHS for COVID regulations in Alberta. So that's independent from the retiree benefits plan. Now, there are some claims when you submit them that will ask you for a receipt when you submit them. This is especially true for our drug claims that require manual adjudication. So in those cases, when we submit a claim and we submit a drug claim, again, you select your name and whether you have coverage with another private benefits plan, and whether this was incurred as a result of an accident. And then as you can see, it does ask you to attach your receipt or document. So these documents, you'll need them on your computer or the device that you're using to submit your claims. If you don't have a scanner, we say that you can either take a picture, you can upload PDFs or images. The only files you cannot upload are files that you could have changed. So you can't upload a Word document, for example, because you could have gone in and changed the amount in that Word document. So they do have to be non-editable documents, but you can either take a picture and upload it, or you can ask your service provider to email you a copy of the receipt, and then you can just browse your files and upload that document. There is a space to provide additional information if you feel that further explanation is required before you submit your claim. This is where you can put that in there. And then again, you just click submit and it will take you directly to the claim submission confirmation page. So this is then when they go to the My Claims, My Web Uploads, and you'll be able to see that we have received the claim we submitted on January 8th and that it's been received. So if a receipt is required at the time you're submitting the claim, it will prompt you to attach it as part of the claim submission process. So each claim that you go through will be slightly different depending on the service that you're searching for. That is why we've developed 3 different tutorial videos, one on dental, one on drugs, and one on extended health claims. Those are kind of the 3 really different ones. Just taking a minute to look to see if there are any other questions.
Hi, I have a question I see I'd like to respond to. That's correct. If you are audited, you wouldn't need to have a prescription for a paramedical practitioner. However, you do need to hold on to your receipts. Hold on to your receipts for 13 months. A portion of the claims submitted electronically will be audited by our claims adjudicator. If anything comes back and it is offside, or it is something that would not have been eligible, the claims adjudicator in the ARTA Retiree Benefits Plan has the right to review your past claims as well. So always hold on to those receipts for at least 13 months.
Gary, there's a couple more questions here that if you could answer, such as will approvals for specific drugs done in the old system require an additional approval process?
If you were approved for a claim within the past year, if you had to get a special authority or approvals through ACBP, we are in the process of confirming all of those claims with the new claims adjudicator, so you won't need to go through the approval process again. Also, where you used to have to get annual approvals for those special authority drugs, we're going to make it so that you are approved for your lifetime. There's a great chance you're going to continue to need those medications. It doesn't make a lot of sense to go through annual approvals. And so we're implementing lifetime approvals for those types of drugs.
Thank you. There is a question about medical aids, so we can look together. So when we are searching, so let's view my benefits coverage. So there are certain categories here, custom foot orthotics. So I guess it would depend on the type of medical aid you're looking for. Also, when you submit a claim, there are a lot of options. So there are mobility and walking aids. There's different choices here. Medical items and equipment, lots of different choices here. There are footwear and orthotics and CPAP machines live under breathing, respiratory equipment and supplies. So it may be a matter of opening several of the different categories to find the exact product you're looking for. If you need details on if your plan covers this, you can also look at our plan summaries. Those are well-designed PDFs that make it really easy to go through and see what's covered. Those live on arta.net under the benefits section. So we can certainly include a link to that in the email that we send out if that would be helpful. But this is kind of where you can see the different items that are found that you can claim against. If that particular attendee's response was anonymous, but if you do want to let us know exactly what you're looking for, we can also let you know whether or not that's covered through a private message. Not seeing any other questions. I'm happy to see if other further questions do come in. Otherwise, if you can't find the answers that you're looking for on the support center or on one of our other MyARTA tutorial videos, you can contact us for further assistance or additional information by calling the ARTA office Monday through Friday between 8:30 a.m. and 4:00 p.m. Mountain Time. Our phone number is 1-885-444-2782. You can also send us an 855. Whoops. Or you can send us an email at arta.net. All of our contact information is also on our website and on MyARTA, so I encourage you to double check it there. I apparently am suffering from number dyslexia today. With a new year, new web tools, and new member ID cards, we have been experiencing higher than normal call volume, and we do understand that it may be difficult to speak with a member of our team instantly, but we are working hard to respond to all of our members. We do thank you very much for your patience and your continued support, and we are very much looking forward to serving you even more closely in the years ahead. That does conclude our webinar today. We will post one more poll that you can take part in if you like. We'll also answer any questions that are typed into the Q&A box. So happy to take any additional questions now. Gary, hoping you can answer the first one. We will also be sending an email out after this webinar that includes links to the article on our website on how to register for MyARTA, as well as a link to our YouTube page where all of the tutorial videos live. This webinar and the other webinar topics will be posted to YouTube in the next week so that you can reference them as you familiarize yourself with MyARTA. I have been told that I have a tendency to cover certain areas of MyARTA quickly since I've been living in it for several months. So if there are any areas that you wish that I cover again and maybe a little slower, please feel free to put that in the question and answer box as well. And I'm happy to go over areas again. Okay, so there's a question about changing your password. So if you have already successfully logged into myarta.net, you can change your password in 2 places. If we go back here, we can, if you've already successfully logged into MyARTA and you've created your account and now you can't remember your password and can't get back in, you can use the reset your password link found right on the homepage. So you just click reset your password and then you type in your email and it will send you password reset instructions. They come from an email address that says MyARTA. If you have successfully logged into your account and you're just looking to change your email address, you can do that from in the system as well. So we'll just log in with our friend Jane again. And so in the update my information section in the top right-hand corner, you can click on that and you can see that one of the very first fields to select is to select a new password. So if you make resetting passwords as part of your routine for security, this is where you can go to reset that password. There are some specific questions about specific products that are coming in. If Suzanne or Gary, if you want to answer them. Would I submit a drug claim form for the meds for sclerotherapy? I don't know if either of you know the answer to that.
You can submit the drugs required for sclerotherapy. The drugs are covered by the plan. The cost for administration of the drugs is not.
There is a question about just the coverage level for your plan. If you do have specific questions in regards to exactly what your plan covers, we would encourage you to call our member services team and to speak with them. They can walk you through all those specific coverage levels. I would recommend, if your request is not urgent in nature and more as just general inquisition, maybe waiting a couple of weeks while the team deals with all of the questions and requests for new member ID cards and access to MyARTA. But within the next couple of weeks, we should be back to normal and we can certainly walk any member that is interested through their coverage. So again, you could also use the contact us form on MyARTA and use that there is an option in terms of claim inquiry, coverage. There's several different coverage options. And so if you use this and then suggest how you'd like to be contacted, and then put some information in regards to specifically what you're trying to figure out what you're covered for, you can submit that and then our team can be prepared and ready to answer that question for you. And it just might make the experience better for you that way as well. So in terms of submitting invoice or claims for 2020, you can absolutely do so online. We encourage you to do so. There is a question, Gary, on to what allowance they go against, whether it's 2020 or 2021. I have an assumption, but I'm not going to.
Things incurred in 2020 go against the 2020 maximum. They don't go against the 2021 maximum.
Perfect, thank you. And will they still be captured on the yearly summary for 2020 if they're submitted in 2021?
Yes, as long as it's done in time. We haven't run those yet, but we do it by incurral date. So as long as it's submitted in the next couple of weeks, it'll be included in the current premium and claim statement.
Thank you. Luckily, lockdown in Alberta has been extended, so everyone should have lots of time to submit their claims until January in the next 2 weeks. So certainly prioritize those. If you're having difficulties submitting claims, again, feel free to contact us and we're happy to walk through the system with you, or those tutorial videos are on YouTube and they do a great job of showing the 3 different types of claims and how to submit claims there. So that does conclude our webinar. We will stay and answer any additional questions that come through, but you are welcome to leave if you are happy and ready to. There's a leave button in the bottom right-hand corner of your screen that you can use to leave the webinar. We thank you so much for your time today and are glad you found this helpful. Again, we will stay and answer any additional questions that come in as well. So we're happy to do so. Otherwise, thank you so much for your time this afternoon, and we look forward to continuing to administer your benefits in the years to come. In regards to the other webinars, so there is a link on our website that lists to the other webinars. We are doing more next week on the other topics. So you can certainly, if you search for webinars on arta.net, the list will come up, or it will be in the email that we sent out in December. So happy to have you register for the other sessions. Otherwise, if the times don't work for you, we will be taking the best of each webinar and posting that one on YouTube so that you can watch them when you're ready. So there were 3 different topics that we offered webinars on, and each were offered at 3 different times. So this one was the general MyARTA tour. We also have one specific to the claim submission, and then there will be one next week on using the app. Gary, one more question on approvals for home nursing care.
Suzanne, refresh my memory. I know we are covering all drugs that were covered in the past. Those are being grandfathered for home nursing care. I believe they have been, but I look to the expert, Suzanne.
For home nursing care, if you have an approval, you can always send us a copy and we'll grandfather that for you. If it's a new case, we'll need a prescription from your physician along with their diagnosis and prognosis.
Thanks, Suzanne. Cheryl, we will be posting the webinar on our YouTube channel. So, and we will be sending out the links to those webinars in January's artifacts. So if you subscribe to our e-newsletter, we'll be posting it there. Otherwise, you can find it, again, if you go on to MyARTA and then you click the help section, the link to the YouTube tutorials is at the bottom right here. So we will post the webinars there so that they can be referenced again. We'll just need to download them and post them. So within the next week, we'll have them online. Okay, thank you so much, everyone. That will conclude our webinar today.